Welcome, everyone. My name is Corinne, and I will be your moderator this evening. Dr. Edward Lowe will be our speaker tonight. He's a practicing dentist, published author, and international lecturer. He will be discussing how to achieve efficient, predictable, and aesthetic Class 2 posterior composite restorations. If you've attended a previous webinar with us, you may have noticed that our in-webinar console has changed, and I would like to highlight some features that will enhance your viewing experience. To contact our speaker, click the envelope icon under the speaker bio box. If you have a question, please type it into the box labeled "Have a Question," and we will answer them live at the end. To talk with other attendees, navigate to your control panel at the bottom of your screen and click the chat icon. Finally, Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by Ivoclar. Dr. Lowe, thank you for being with us tonight, and I'll pass on over to you.
Okay, well, thanks. Welcome, everyone. I know some people are on the East Coast. They're at a different time, and over on the West Coast, I'm in Vancouver here. It's 5 p.m., so it's the end of the day for some of us. Some of you have already had dinner. First of all, I'd like to thank Henry Schein and Ivoclar Vivadent for the opportunity to present. I want to say that all my images have not been altered except for global adjustments, and they are my cases, so I'm excited to share them with you today. A bit about me. I practice in Vancouver, BC. I've been practicing here for 35 plus years, and I graduated in 1986 from the University of BC. So, I speak and lecture and do a number of different things, but I mostly enjoy spending 4 days a week here at my office in Vancouver practicing full time. So I don't necessarily lecture or speak full time. I love dentistry. I love practicing full time as a wet finger dentist. In addition, I get to educate. I speak a little, I write, I teach, I take a lot of CE, and I evaluate products for other clinicians and for manufacturers, so that other clinicians like yourselves know what they're about and what I like or don't like about them. So I get to test drive them for you. Other things I do, I'm the editor-in-chief of the Journal of Cosmetic Dentistry since 2010. I'm an examiner and accredited member as well. So anyone who's interested in writing something for me, be sure to contact me if you have an interesting case. Okay, today's program topics, it'll be a fun one today because I love doing posterior dentistry, and as much as I do like doing cases, a well-done posterior composite is something that, there's an art form to it as well. It's not just your day-to-day. Posterior composite systems for efficiency and aesthetics, and then we'll go on and talk a little bit about instruments for posterior class 2 restorations, matrix and wedge systems, and in addition, we'll go through step-by-step posterior class 2 restorations, and maybe a couple of tips and tricks that I can share with you that I've encountered and solved along the way as well. The class 2 composite, it's one of the most common procedures a general dentist does. I think that, if you look at, go to everybody, if everybody did a survey, class 2 restoration is the most commonly done of the restorative procedures. And most commonly, patients still get them no matter how hard we try, because some people just don't floss, or it's often due to caries. And ultimately, the success of any class 2 restoration starts with getting a good proximal contact and embrasures. I can't count how many times, I see a new patient and they've got some composites in there and they say, well, it shreds my floss, or it catches, or I pack food in there. So getting great proximal contact is number one. While getting great contacts is important, like a properly adjusted occlusion and getting the occlusal anatomy right are just as important steps, mainly because if the person can't bite properly, or it hurts to bite and they don't adjust it, it can lead to other things. So a lot to it. Composites and crayons. I like making this comparison when choosing a system because they both make you happy. How fast and efficient do you want to work? We want to work efficiently and quickly. A class 2 MOD should not take you an hour and a half to do. I exaggerate a bit, but in dental school, That's probably how long it took. It took quite a while to get everything right. So what level of aesthetics and how good do you want your final restoration to function and work? Because I'm speaking with for Ivoclar Vivadent and representing some of their products today. I do a lot of work with a lot of Ivoclar Vivadent systems. I'm disclosed that I've been working and speaking with them since 1997. So, one of the systems, if you want to keep it real simple, it's like a box of 4 crayons, is Tetric Power Fill and Power Flow. There's not a lot of shades. There's 3 universal shades. It's mainly for posterior use. Keeps the work really simple. There's not a lot of thinking involved. And the translucency and opacity is balanced. And I'd have to say I do use a lot of the Power Fill and Power Flow on my day-to-day basis for my posterior restorations. You'll see that I do a lot with them down the road, and I can make them real fancy. But your basic bread and butter work, I don't necessarily use a lot of colors. Tetric Prime and Tetric Evo Ceram is like a box of 24 crayons. You've got more shades, you've got some anterior and posterior use, and you've got a little bit more play with it. You've got a bleach shade, a translucent shade. You can stratify a bit with some dentin shades. And so as you can see on the picture down here, you can do a little bit more with it and get a little bit more color and a little bit more artistic. Now, Empress Direct, although you can use it in the posterior, it's got 32 shades. It's mostly an anterior composite system because it offers so many shades of translucency and colors that I think that if you have the system, you can use it in the posterior, but I like to keep it simple. So this for me is mostly an anterior system. So what is the Ivoclar Vivadent 3-second power cure system anyways, and why was it developed? Well, I've been around for quite a while, so I've watched the Tetric Evo Ceram and the Tetric line develop over time. And, they have one solution for mostly all of your posterior composite work. So for every indication, you could probably find a place for one of these products. And what's nice about it is that it covers everything. So if you're looking for one system, the Tetric Evo line is probably going to cover it all. And while it's had great success over the years, it's had more than 10 years, 15 years of clinical success and many restorations. So the R&D is good, clinical studies are good, so there's a lot of papers written on it. How can it be better? Ivoclar says, hey, what's next? How can we make this work even better? And one of the things about it is, we all want to get faster. We want to be efficient because ultimately, if you're more efficient, you work efficiently, you're more productive, and in the end, your bottom line is better. So Ivoclar Vivadent wants to reduce the number of materials so it's not as confusing, shorten your working time so that you can work quickly, and trying to look out for you so that you don't make any errors while keeping the aesthetics and the quality in check as well. So, the art of efficiency and the 3-second cure saves you a lot of time in the end if you work with the system. I like it a lot. So the system involves 3 things. It involves the Adhes Universal in the pan or the bottle, which is the bonding agent, the Tetric Power Flow, which is the flowable, and the Tetric Power Fill, which are both the bulk fill systems that they have, and the Blue Phase Power Cure Light. Now, this light is open and compatible with other materials and curing lights. It may not always be 3 seconds, though, because 3 seconds at 3,000 milliwatts per centimeter squared is a pretty powerful light. Now, you can see the times and the intensities. You look over here, if you use power fill and you have a weaker light, the exposure they recommend is about 20 seconds. And the same with the power flow and the 10-second cure for the bonding agent. But if you get down faster and faster because you're using it in the posterior, it could be 3 seconds, 3 seconds, 3 seconds for a total of 9 seconds versus 50 seconds. So you can see that you begin to save time as you go to a faster system while doing the same thing. All right, so the Power Cure system makes things a little bit faster. It's mainly indicated for class 1 and class 2 restorations, though. in combination with these materials because they're designed to cure at a deeper level, 4 millimeters plus, and then also it's designed to cure efficiently with this light as well. It's for permanent dentition, and it's light cure from the occlusal surface, so it's not recommended that you cure it in other directions or aspects. Materials can be used in other indications, including primary teeth and cure from other aspects, but don't use the 3-second cure program. Use the 5 or 10-second for that. So, we're going to focus today on over here in the class 1 and 2 area, mainly class 2, but I'll go over class 1 mainly because of my philosophy about turning class 2s into class 1s and filling them. So the 3-second cure, if you use this system, I like it. I think it's a really efficient system for getting stuff. And I tell you, 80% of my work is done with this material when I do posterior composites. So it's very efficient. Okay. So my philosophy is a class 2 restoration. I want to restore the proximal and finish as a class 1 occlusal restoration. So if you get rid of the box area, whether it's an MODO or an MOD, you're left with the occlusal surface. And then from that, if you understand how to build from there, you're able to create a very nice looking restoration that's attractive if you want it to, or you can make it functionally work very well and very quickly. Here's a simple tetric power fill class 1. And all we did was remove the decay, clean it up, bond it, and you can see the coloring is pretty good considering that we only have an A shade, a B shade, and a whiter or bright lighter shade to fill that with, and in one increment as well. For a class 2, you can see both right here. If I got rid of this box area, I can turn this class 2 into class 1, and these two become class 1 restorations. So here, once again, is a 1 shade, quick and easy, not a lot of groove stain or anything else, but following the anatomy of the existing tooth, we're able to build a nice restoration for this person. When I'm building cavity preps, there are some things I like to think about to make sure that these last a long time. I'm often surprised myself at how long these restorations last. And ultimately, we want these at least to be 12, 14 years plus restorations if the occlusion is correct and we seal them well. Most class 2 failures are from micro leakage or decay at the margins going right underneath. So your ideal cavity preparation, if you look here, you want to cut across the enamel rods as if there was a spoke in the center of a wheel, and you want to follow the spokes out from the hub at the center of the tooth and follow that way, so you don't leave any undermined enamel. So the preparation angle, if you look from the center, you notice that the orientation of the enamel rods, right? So they go this way and this way. So if you follow it and cut this way and you follow it along, you're not going to undermine and leave enamel that is unsupported. Hence, that could break off down the road, leaving a gap, or it could develop a white line, and recurrent caries and plaque could stick to that. So you want to cut across the enamel rods as you're prepping, actually the other way, straight out, so that you've got not only a good bond, but you decrease the risk of any micro leakage or any gap. White finish lines. How often do we see that where you finish the restoration? Why are they caused? Why do you get it? So in your restorative margin here, then all of a sudden you see this white line outside of it. And often it's the fracturing of the enamel margin producing a white line. Now, I think to myself, well, why do I get a white line? Why does this happen? I was very careful. I had a rubber dam on and everything looked really good. White finish lines possibly could happen because once again, you undermine the enamel and you leave unsupported enamel. So on the occlusal cava surface margins, the enamel rods are naturally beveled. So if you go straight up and down or go divergently, obviously what you're going to do is you're going to cut across the enamel rods and be able to bond to the restoration a lot better and leave less of a white line. Other causes of white line include overfinishing or annealing a new composite restoration. That means you keep polishing and polishing and polishing it in an area where it's quite thin by the margin. You overheat it, and you can cause a white line because you distort the composite. Number 2, volumetric shrinkage at the margins from bulk filling. So you do a bulk fill, and all of a sudden, while I've packed it in there, and my material isn't a bulk fill material, and it pulls away from the margins, leaving a short gap, and you could go in and seal it or do something about it. So maybe a material that's not designed for bulk fill, you try to bulk fill it, and you get volumetric shrinkage from the margins, and shrinkage stress creates a gap. Another one, thick layers of bonding agent. Number 3, causing shrinkage stress on the bond to the undermined enamel. Too much bonding agent that wasn't thinned, and in the gap, you have bonding agent instead of filling material, can cause a white line. And number 4, prep diamonds with a large grit size, larger than 60 microns, and no finishing. In other words, your cavity prep isn't smooth, and from there, the composite doesn't adhere to it evenly. So in areas where they're thicker and thinner, as you go to finish it, it can leave some gaps, or it can pull away a little easier. So these are the causes I found of white lines, which you can prevent understanding where they're coming from. So in your ideal preparation, I want to see a finishable interproximal margin, so I am able to get in between there and put a disc there and finish it. Because if it's too tight, I won't be able to get in there, and I won't be able to fit a band in there. I want smooth and rounded line angles where the edges are nice and smooth and rounded, especially at the cable surface margin. So I want to bevel that, and so that things adapt quicker. I don't want to leave a thin bevel. I just want a nice, slightly beveled butt margin, if you would say, and rounded as well. So when I start a class 2 restoration, and I know there's decay in the X-ray, my favorite prep burrs to start the preparation is, I like diamonds. So I'll use a diamond 330 or a KS0 to start that, because they're thin. The tip is thin. I don't like struggling and pushing on a carbide if it's dull. These tend to stay sharper for me. I just simply like using diamonds. A 330 or a 1557 crosscut would work just as well in the carbide as a carbide. So they're my favorite starters. So I'm going to start the box in that area and expand it. I don't want to take a great big burr and start that right away, because I don't want to nick the tooth next to it, or scar the tooth next to it, or take off too much tooth structure when I haven't identified fully the extent of the caries underneath. My favorite prep burrs for gross prep and box development are these. I mean, certainly if I want to take decay and things out in a hurry, this kind of very large 330 in a super coarse is what I like to use, because I like working quickly. So, but you have to be careful, because it works super quickly. And these inverted bucket burrs, the KR burrs, are nice because they're almost inlay burrs, and so I ensure that on the cable surface margin, I won't undermine the enamel and leave unsupported enamel. I'll cut across the enamel and get a nice bevel to the enamel orientation on the occlusal surface. The proximal finishing burrs that I like. So once I finished it, I want to smooth my box. I want to smooth the cable surface margin. I like using these. The mosquito burr over on the left here is really thin, so I can fit into areas where maybe, I just want the proximal buccal lingual just clears. I've got a little bit of an opening. I can squeeze that in there. If it's a long box, I like the super long round end tapered diamond chamfer, or this friction grip 012, 8x6 012 if the cavity prep is large enough. And I'll round all my line angles with that. Then from there, my favorite occlusal anatomy burrs and proximal finish burrs are this upside down Christmas tree shaped burr, because it's been very similar to a lot of the hand instruments like you. It's similar to Ivoclar's P1 carver. And if you carve the anatomy of posterior teeth, you want to maintain triangular ridges. So I don't want to take a football shape or egg shaped diamond and start doing my occlusal anatomy with that, because it'll dish it out and you'll lose the function of the triangular ridges on your molar. Another good one are both these flames. This is a very long, thin flame for doing some finishing interproximally, and some occlusal anatomy, and the flame 7901, the classic flame carbide diamond. So I like using these burrs when I have to do occlusal anatomy and occlusal adjustments. Burrs, these are your pointed football diamonds and carbides, fine carbides, and the numbers are 368016. So they're a little bit smaller than the larger 0223. A little easy, a little bit more maneuverable for me. Shaping and finishing instruments, I really kind of like the Softflex discs and mandrels. There are many great discs and mandrel systems. I know Cosmetic makes a good one. Clinical Research Dental makes a good one, CRD. So there's many different systems you can use for discs. Just make sure they're nice and thin and they're one-sided. Okay, so the reason I'm going through a posterior class 1 restoration before I go on to class 2s is that I want you to understand how to develop a little bit of the anatomy or the shaping of or the filling part of a class 1. Because after all, I said, I'm going to teach you how to close the box off, the proximal boxes, and convert it to class 1. So let's follow this through for a second here. Here's an upper molar on a dentiform, and you can see that I've done my cavity prep, my occlusal prep, rounded, and smoothed it out. And I'm going to do this with power fill. And as I go in, the prep is 4 millimeters deep, so I can do it in 1 increment in power fill as possible, or 2 millimeter increments with tetric prime or any other composite that takes a little bit longer to cure in terms of depth. All right. So I can selectively etch total etch with phosphoric acid. So my first step, if I just want to etch the enamel rim and do selective etching, I can do that. I can do total etching with phosphoric acid, which means I can etch the enamel and the dentin at the same time. 15 seconds is what I usually do on the enamel, and then 10 seconds for the dentin. And rinse that out and dry it. And then I apply your bonding agent. In this case, I like Adhes Universal for 20 seconds and then air dry it. So I apply it, make sure, keep it wet. I mean, I always think to myself, if I keep coating it, take your time with this. Don't be in a hurry to put bonding agent on really quickly and then blow dry it. I just want to take my time, making sure all the surfaces are covered. And then when I air dry it, I want to see a shiny, kind of oily surface. So I cure with a blue phase power cure light for 3 seconds. And I want to see this kind of, it shouldn't look dry because, like you've just etched the enamel, or frosty. And yet it shouldn't look wet, like a puddle. It should look kind of oily. The surface is how I like to describe it, is the right amount that you have wet the surface of the tooth prep. So here I'm going to do it with power fill. In this case, I want to fill halfway with power flow, cure for 3 seconds. I can do it that way, or I'll omit this step and go straight to filling the entire prep with power fill. Tetric IVA is the shade. It's like an A shade in the A2 range, A2, A3 range. And then, I pack it in thoroughly and adapt it. Here I'm using an Optiscope ball tip. Optra Pad and Optiscopes are Ivoclar Vivident carving products and shaping products for composites. And they're excellent for me to use because I can change the tips. I like that. So I can choose the tips I like. So I pack that in. Here I am. I'm defining the grooves, fissures, and ridges with the pointed tip as well. So I want to follow the anatomy. I mean, I'm lucky. This is a dentiform. There's lots of anatomy. Many times, you put all this anatomy on, the person is a bruxer. And so as beautiful it is, when you go to adjust it, you grind the thing flat. So you pay particular attention to adjacent teeth when you're restoring posterior teeth, because If you build it this way, instead of overpacking it, you won't spend all that time trying to grind it down later to get it, the tooth into occlusion. And sometimes, if I want to know where the tooth occludes, pre-op, I'll have the patient bite on articulating paper to kind of mark where they're going to bite ahead of time. Okay, so here I am using just another tip and adapting it, the chisel tip, and adapting the edge of the composite. And then I like the P1 carver and any interproximal carver. I really like the Cosmodent one because I'm used to using it, but there are many good ones, that Schein will carry. If you look under IPC carver, interproximal carver, that you can use for this purpose. The thinner, the better. You can see that P1 carver is the shape of the head of the Christmas tree burr I was talking about in the end. So we stay within that family to shape it. And then if I wanted to find pits and details, I can use an Explorer to do that, and then I'll cure the restoration. So here I am trying to reproduce the anatomy that was gifted to me by the dentiform. And so here I'm taking finishing diamonds of my choice, but if you have your choice as well, and just redefining the anatomy on here. Here's a class 1 restoration with power fill. We're polishing it now with the Optiscope polishing system. Whatever nice composite polishing system you like to use. And I like to use these Optiscope brushes because they're like jiffy brushes, if you like those too. Because I think they give a nice shine and it tends to clean it off really nicely. So here's different views of that class 1 restoration. It's all finished up. I've tried to follow the anatomy on it. Yes, it's not a real tooth, so it's not going to match the ivorine that this is made out of. But I'm pretty happy with the way it turned out, and it's a quick, efficient way of doing it because of the 3-second cure and the 1 increment. So here's the finished class 1 restoration. And so understanding how to do that, here's one in the mouth of a power fill class 1 occlusal, old amalgam, remove the amalgam. And I always do posterior restorations if I can under a rubber dam. I mean, I know that for everyone, it's not the ideal situation. Sometimes you can't get a rubber dam on, but I do my darndest to get a rubber dam and isolate the restoration because it makes life easier. Your dental assistant will be happier, and I think you get a better restoration in the end. Here we're putting power flow to 2 millimeters and a 3-second cure. And then I power fill IVA to the cavus surface and shape it for a 3-second cure. And then in the end, I go ahead and finish with the Optigloss, polishers and burrs so I can get a restoration. So here's how we started. You can see that there was a bit of decay here, some amalgam staining underneath or micro leakage, and we're able to reproduce something like that. We can talk about pit and fissure staining, but I have a funny story to tell because, I take a lot of pictures for study club or presentations and that. And I always try to do this pit and fissure staining on upper teeth because I did one on a patient on the lowers one time and put all this nice groove stain on to match it. And he basically said at the end of it, why'd you put all the decay back in my teeth? I wanted all that out. I wanted it white. So, there you go. In real life may not always be the same as what you want it to be ideally as a dentist. Okay, so that's a nice result. I like that. So let's talk a little bit about class 2 restoration. So I'm going to do one with tetric power fill as a class 2. So here's the lower molar. And, the sectional matrix system rings. I mean, we're trying to separate the teeth for great contacts. And there's many different systems out there. There's a Paladin one, there's the Garrison one, there's a Trident one, there's a CRD. There's a lot of rings out there, and they're responsible for the tooth separation for contacts. There's the Composite system that this is the older rings. In certain situations, I keep the shapes because I use them. And then the Trident V ring. In certain situations, I use these. And the Composite 3D Fusion is the newer system. Once again, it has the super wide one, which I like. And so that's another system I use. So the Garrison is the one I'm currently using a lot of. They have the short and the tall rings for separating. And the majority of the restorations, I use these. Occasionally, I'll need the green one for a wider prep when it extends beyond the interproximal area, where I have to put a band and I want to be able to hold a little bit more. So it's more versatile in that way. Sectional matrices and bands are your anatomical contact points. Their job is to give you a contact, and their job is to be able to shape an anatomical contact so you can floss. There's contact, food doesn't get caught in there. Many different types. So you can hear, this is an old slide of what it looks like when you have an x-ray of a Tafelmeyer band, or trying to use a Tafelmeyer band, which is more V-shaped, to try and create something that is more barrel-shaped in the contact, is not a great contact. And how many times does this break through finishing or adjustment or wear, and the person just traps food as an open contact over time? Whereas you see this is in the occlusal third, the actual contact with a sectional matrix is in the middle third, where the contact of molars mostly are. It's more anatomical, easier to clean. You don't leave a big embrasure, gingival embrasure where you can pack food underneath as well. The sectional matrix wedges are for adaptation, not separation. So if you shove a wedge in there, the idea is not to separate the teeth, but it's to adapt the sectional matrix band to the tooth you're working on. And there are many of them. Once again, here are some of the Garrison ones. There's the wizard wedges. There's the anatomical wedges. And many companies have many different ones. But you can tell some are just the simple triangle right up to where you can adapt, because on some of these teeth as well, sorry, I skipped ahead. On some of these teeth as well, they don't adapt well. For example, upper premolars can have a mesial furcation area where the band doesn't adapt really well. Upper first molars have that too, or just anatomically you have a funny shape. And so these wedges, they kind of spread apart or have little tags on them that can adapt to that space, are very helpful in that situation. And I have a couple tips for you near the end there on how to get it if even these don't work. So the Garrison matrix system pretty much looks like this for me, and that's what I'm using right now. But like I said, you got to find a system that works for you and that you're comfortable with. This is more or less how the placement of a system goes. I mean, I'll go through this pretty quickly. You have your band, you have your prep. The band goes in first, and you find one that's suitable and of the right height. You want to make sure that up here it adapts well. It's higher than the edge of the tooth. You don't want a premolar band on a molar because it'd be too short. You put the wedge in to adapt it, and then you find the appropriate ring, in this case a molar or a wider ring, and the adaptation is quite nice. It hovers and embraces the wedge, and you get a nice close adaptation. And in this case, in these types of matrix band, there's a little tab. Some have a tab with a ring on it and pin forceps where you could pick it up. In this case, they're making a contact point. You always want to burnish the embrasure so that you have a contact area, and you want to make it broad enough, not too broad, not too thin, but just right. And then you shine the light, cure your restoration. You'll take that off, and voila, you have pretty much. Oh, if only it was that easy and everything came out perfect like that every time. It makes life a lot easier, and then there's just minimal finishing to be done after that. So posterior cast 2 restoration with power fill. There's a mesio-occlusal distal prep. From here, I've got a posterior class 2 restoration. I've got my composite type matrices and bands in place. Here's a case where I've got a tall and short ring. I've got it put together there. And I'm doing my etching. I won't spend a lot of time on this. My etching technique and cure for 3 seconds. So here I've added power flow to the level of pulpal floor and in the box areas so that I get a good seal. My feeling about it is you don't have to do that step. Use flowable. I don't use flowable as often as I used to because there's a lot of literature out there that says if you can get a material down there, it's going to be just fine. Flowable isn't necessarily a necessary step. For me, I'll use an explorer to spread the powerful evenly. And if I'm using flowable, sometimes I paint the band and cure it. So that if I'm layering interproximally, I don't get something that looks like sedimentary rock where it's not nice and smooth. Sometimes I paint the band with it so it's super smooth. And then I put my IVA power fill and I adapt it with the ball shape to just pack it in there. And then I define my marginal ridges. I like putting this up here and just kind of using it as you see here to just kind of shape it away from the matrix band because I want to try and create an embrasure space there so it looks a little nicer and easier to work with when I'm done. So right now I've shaped it. I'm starting to use the tooth as a scaffold. I'm using my P1 carver to put some anatomy in there. And then from here, I'm going to cure with the blue phase power cure light for 3 seconds and make sure it's cured. And now I want to take off the rings and pull the bands out halfway. Now that's something I do. I hope you do as well because it makes it really easy to finish. And the reason I pull the bands out halfway is now I'm going to take them and I'm going to fold the sectional matrix back like a baked potato. You're pushing the foil back to expose the marginal ridges. You can see that in here and here. Now with the marginal ridges exposed, I've got a lot of room to kind of slip a disc in and begin with a medium disc and begin to create my embrasures, 3 of them. There's going to be an occlusal embrasure, a buccal embrasure, a lingual embrasure. And I tell you, this works much better than just trying to stick a 7901 flame burr and gouging it. And that's when people get these jaggedy marginal ridges or areas where you go to floss and you can't clean out the flash really cleanly. And the patient says my floss shreds or my floss gets caught. So here's the class 2 restoration with power fill. You notice the buccal and lingual dovetails. It's very clean. There are dovetails here. The V is very even. So you can see the embrasure development as we go along in all 3 directions. Then I can finish with my fine and super fine diamond burrs and make it nice and clean. All right. So, using that again to help me. I'm polishing with the Optipol or Optigloss, whatever system I happen to like at that moment for polishing. The Optigloss is pretty interesting because it polishes both composite. It has composite and porcelain polishers on it. So if you want one system that does both, I think it might be the one for you as it is for me. Different views of the class 2 restoration. You can see that anatomically, I love that. Floss isn't going to get caught in there and it should be a nice snap. And so there's your finished power fill to class 2 restoration right there. Now we're going to do that on tooth number 4 in real life. I'm going to kind of move fairly quickly here because I noticed that we're getting caught up a little bit on time here. So I've got about, say, 10, 15 minutes left. Okay, great. So here's your tooth number 4, class 2 DO. And after getting it isolated under the rubber dam, here we've got the amalgam removed and your matrix placed. A case where I just put the IVA in 1 increment. I'm going to shape it and adapt it with the P1 carver. Cure with the light for 3 seconds. And finish with a soft flex medium disc. And you can see with this extra here, the disc just gets in there really well after I peeled the foil back. And I get upper finish and pre-polished. And here's your power fill class 2 DO on number 4. And that's what it looks like finished. Over here, I have another one. This is a real treat because I happened to find this yesterday, and I thought, well, maybe I'll shoot it for the webinar today. So it's a 29 DO and 30 MO with power fill. And he had decay that was was interproximal. So here, I like to place a wedge ahead of time when I'm prepping, and I'll tell you why. As I got this started with my 330, I'm finding the caries. And as I expand it, it protects, the wedge protects the rubber dam, the papilla, and retracts the papilla. And I'd rather do this to my wedge and chew it up than have the old flying piece of rubber dam and having it spin and make a big noise, or have the papilla bleed. But you notice how clean that is. It's retracted the papilla, and it's got a nice clean margin for me to restore with. So here I've got my matrices and ring placed on both sides, on etched and bonded with Adhesive Universal, and the 29 DO filled in one shot with Power Fill IVA. So I did this in one shot, shaped it with the P1 carver, adjusted the band a little bit. And so now I've removed the one matrix. So when I've got them together like that, when I finish one restoration, I like to pull the matrix out and then reestablish my contact with a second matrix. And so you can see I've pulled the one out of 29, and I've got the one band on 30. I've got some flowable on the floor, and I've burnished the contact again. So I've got a nice snug contact there. This avoids you having a open contact when you're finished. So I put a little Power Flow IVA down here because I just want to do it a bit differently. And in this case, I to do the marginal ridge when it's small, or even when it's large, when I've filled it and I've got the box and I'm going to convert it into a class 1, let's say, I like to roll a piece of composite into a grain of rice and place it in the box of number 30 and manipulate it into place, because I look at the marginal ridge is rounded like that. And a piece of composite placed there and adapted is an easy way to get a nice marginal ridge. So when I'm done and cured both of them, I'm going to lift this out halfway. I'm going to polish this, and then I'm going to fold it the other way. And I'm going to develop 29 without scarring number 30. And when I've developed the embrasure on 29, I flip it over, and I'm going to develop the embrasure on 30 without scarring 29. So now I've got it nice and clean. I'm going to do some final polish with some burrs or cups or brushes, and finishing burrs as needed. And this is my immediate post-op yesterday. And you can see where I placed you can barely see where I placed the restoration using one shade. I didn't go in and take everything out. He had this restoration done at another office prior to seeing me, so I didn't see a need to redo that. We did some class 5s here as well. And so on these two teeth, so, you can see the embrasure and everything worked out quite nicely for him, with one material, one shot. Okay. So Tetric Prime, we're going to move on to another material. So I'm going to striate and maybe layer some of these materials. There's more shades here, more colors. So let's see what we can do with this one. So Tetric Prime, it was developed for prime handling, because I've done a lot of focus groups where a bunch of clinicians will sit down and they say, and one of their main concerns is, well, I don't like the way it feels, the way it handles. It was a big deal. So they came out with Tetric Prime. So it has a lot of shades, and it handles a bit better. Plus it has that nice translucent shade. That's very similar to Omnichroma. So Ivoclar is going to focus on these 4 products with Prime and the Power Fill for most of the solutions for the posterior and anterior, if you're going to look for a set that covers both. So there's Prime handling. There's 12 shades that we talked about earlier. High radial opacity compared to Omnichroma when side by side. So it's nice to be able to see it in a radiograph. Low shrinkage stress, so the margins don't pull away from the edge, so you don't get white lines and gaps. Longer working time, so it's less light sensitive. If you're blasting overhead light from your loops, it's gonna cure, but it's more resistant than others. And they do have that transparent shade to compete with Omnichroma, so it works very well if you just want one shade. And you don't want to worry about anything, and you're using the Prime system. So I like that material for that. And it has enough shades that you can work with it in the anterior as well. So shades, efficiency, blends well, it handles well, high radial opacity, low shrinkage stress, longer working time. I want to move along here. And we're going to talk a little bit about a class 1 with tetric prime. How would I do it differently? Well, here's my occlusal prep again. We don't want to waste too much time with how to prep it so much because you've seen this, but let's get right to it. So here I might want to put a little more color with it. So I will fill halfway with A2 dentin because I have that choice now for a little bit of chroma or color. And then I kind of shape it into place and build up the triangular ridges with the Optiscope tip. And then cure that. And then I've left enough room for transparent enamel shade. So I'm going to follow the shape of the teeth by putting increments for the triangular ridges and in small increments. And I'm going to add that transparent so I get that chroma coming through from the dentin color. And now I begin to shape it. So you can see that this adds a little bit more color to it. Now I've gone to a multi-shaded final restoration. So I'm doing it with the same shape and everything else to try and get it to blend and fill out as well. So here you notice the grooves and fissures suddenly magically appeared because I don't cut pits and fissures in. I just follow the triangular ridges on these restorations and the grooves and pits and fissures automatically appear. So here I'm using that Christmas tree shaped diamond finisher to do some, a little bit of the shaping of the anatomy, do the polishing, and we're going to end up with, once again, a restoration that looks like that. Similar to the one we did with the power fill, except I've used 3 different colors here. So here's another one, tetric prime, finished with a class 1 restoration that I did. Here's one with tetric prime occlusal, tooth number 19. Rubber dam is placed, enamel etched, adhes. So I put some A2 in at first for the dentin color and to try and mask out the dark dentin. And then I just shaped enamel transparent as the enamel layer and cured for 5 to 10 seconds with a power cure light because it's not a power fill. So I have to cure it a bit longer. And here's my original, and here's it finished. And so a few more colors, a little bit more depth of color, so it's a little harder to see. It blends in a little bit nicer. So, okay, here's the fun part. Now we're going to do a class 2, and we're going to put groove stains and color it up a bit. So let's run through this, and we're in good shape here. So here I've got class 2 restoration with tetric prime. Here's my prep. And so I'm going to place the composite type ring and the band and everything else here, but I'm going to do it a little bit differently. So here's the etching technique. I've got my bonding agent in. So my first layer, I'm going to put tetric prime A2 to the level of the pulpal floor in the box area. That means I don't go higher than the pulpal floor. I put in the gingival floor and no higher than the pulpal floor. And then with that, that's the chromatic layer, so no more than 2 millimeters thick. Now I'm going to go in and I'm going to roll some tetric prime transparent into the grain of rice shape and adapt it to create the marginal ridge and cure it. So you can see I've turned this class 2 into a class 1. I can even take the rings off at this point because it's not going to do anything. I left the band in there so I can do some finishing. Now I've removed the rings. So now I'll use tetric prime B1 to highlight the triangular ridges. They're a little bit brighter normally because the enamel's a bit thicker. So I might want to get creative and I want to put a bit more of a high value shade on the triangular ridges and begin to create some pits, some fissures and anatomy here. And so I'm going to use Empress Direct Color. I mean, there's 7 different shades for, a number of different colors. But for our posterior restorations, I'm going to use mostly white and honey yellow because white simulates the enamel cracks and blemishes. It also masks discoloration, and you can do fluorosis stains that are a bit yellow there. Ochre and brown, I can simulate the stained fissures. I can deepen the chroma of the occlusal halo fossa, the center of the posterior tooth, and I can simulate worn cracks. Gray, I don't use gray often, but if it's a really dark stain, I'll use that as well. So here's the posterior class 2 with Tetra Prime, and I'll paint the fissure with a little of the ochre with an Explorer. I always say less is more because you don't want to overdo it. It just looks like a blotchy mess when you do that, because it's hard to get rid of it once you put too much on. So less is more, and I place that in, and I do not cure this. So now I'm going to place a bit of the darker color, whether it's dark brown or gray. I'm going to take an Endo Explorer, and while it's wet, it's going to be like watercolor. I'm going to drag the Endo Explorer along the groove line. So now you can see I'm drawing grooves in here. And then I'm going to go in and create these pits and fissures, as you can see. So now with that done, I may want to say, well, you know what? I want to highlight the marginal ridges with a little hypocalcification. So maybe I want to add a little white there. So I feel like Bob Ross, the painter here. I see a little white spot on the triangular ridge. I want to add a little bit of color here. So here you go. Now we've added that, and we cure it so that we freeze those colors on top of the dentin layer that we placed. Now what I do next is put the Tetra Prime transparent on top to and I'm going to veneer the triangular ridges and shape with a P1 carver, and follow the anatomy once again, like I did with the others. And then I refine the anatomy, and I reach for the color with the IPC carver. So the further I reach with it, the more of the groove stain shows through. So depending on the adjacent teeth, I can reach for as much as I need. So here I do the final cure with the blue phase power cure for 10 seconds. And now I use my disc to shape it again. And as you can see, I've got a kind of different looking tooth this time. It's got a little bit more realism to it. And so there's my posterior class 2 restoration with Tetra Prime. You know, the embrasure development's the same as what we did before. So I'm repeating myself. And I finish and polish with the Burrs and polishers. So I'm reaching down for the color, maybe adding some secondary anatomy. So there's my finished restoration with some groove stain. So that's a little bit different. So there's the Tetra Prime, the fancy version of the class 2 MO restoration. So here's just some examples of the groove stain and the Tetra Prime here in an occlusal restoration. Here it is in a occlusal and an OL on the molar, and I've got some hypocalcification there. Here's a case of where, I've got an OL, MOD, MO restorations, all done with a little bit of groove stain. And notice they're on the upper teeth, so the patient doesn't see them. All right. So here's a classic example too, of Tetra Prime class 1 and class 2 restoration side by side. So here I'm just trying to copy the molar and premolar and just add some stain and color to that to make it look real. Difficult contacts. I'm almost done here, gang. Difficult contacts. Let's say you have that mesial fluting or area where there's a furcation and you can't close it with a band and the wedge simply isn't shaped right. One of the tricks I use is I'll roll up some Teflon tape and I'll pack it in there and adapt the band against it. So that trick works for me. Another trick I use sometimes is to take a cotton pellet, if you don't have Teflon tape, with bonding agent or unfilled resin, and I'll wet the thing. And then I'll take it and I'll pack it in interproximally to take up that extra gap that's down at the cervical and gingival floor. So the contact with the band, and I'll seal it up, and then I'll light cure it because it's got unfilled resin or bonding agent. It isn't likely to stick to the tooth and it's pretty easy to remove. Challenging matrix placements. Sometimes, how about this one? I'm doing a DO, an MOD, a MO, an OL, and an onlay. In this case, when am I going to put the matrices and where do they go and how am I going to control that? Well, I prep everything. What I like to do is I always pick the middle tooth first. I'll put a Tafelmeyer around it. And without any banding or matrices, I'll put 2 sectional matrices inside the Tafelmeyer band. And then I will take the Tafelmeyer matrix and squeeze it tight. So I restore that tooth first. And so with that tooth restored, now I'll go in and polish it and finish it, get the embrasures and everything right. And now I've got something that the DO on the first premolar can back onto to make a contact. And the molar has a contact, trigger happy here. So the molar also has a contact here too. So now it's just your standard MODO against a natural tooth. And the same thing over here up top. Now, once again, I've got an onlay prep, and boy, I've taken the amalgam out. How am I going to get a contact? I've got the Tafelmeyer again. I put a sectional matrix inside it so that I've now developed the teeth this way. I've got 3 restorations, and I've still got my onlay prep free to do that. So that's what it looks like there as well for a challenging matrix placement. I can talk about favorite composite instruments real quick, and then we're doing pretty good here. My favorite composite instruments, the intraproximal carvers. Elmore makes an excellent carver that's yellow for doing anterior and posterior teeth. So it's got a little spoon at the end of it. That's nice. Suter makes a bunch. I like this one the best, the green one, because I like the point, and it's similar to a P1 carver. This one for anatomy, because it's got an explorer end and a pointed P1 carver, kind of Christmas tree end for posterior restorations. Of course, the P1 carver is my favorite. I use it it's on the tray for all my posterior work. And then Optiscope Pad is for shaping composites on bigger restorations. The pad works like this, and you can use it for anterior or the smaller tip for posterior restorations for class 5s. And it comes with different tips that you do with the Teflon surface, allows it not to stick. So it's a nice instrument for anterior bonding as well. And I also use it to place veneers because it's a nice way to hold the veneers placement. And the Optiscope kit is the one we saw earlier that you dip with different tips that you can put on. And there's 3 tip shapes that you can pick, obviously. So with that in mind, you have a choice. And I always like this line from Harry Potter. It's our choices, Harry, that show you what we truly are, far more than our abilities. So you as a clinician, the sum of the choices we make often in life determine who we are. And as a clinician, the sum of the choices you make for your patients in part imports the future of their oral health. Like, do you choose this material, that material? Is it porcelain? Is it composite? Is it direct? Is it self-etch? These are things you think about and is unique to you in your own practice. So my closing thoughts, choose a composite system that meets your specific requirements and skill level. Simplify composite artistry. Ooh, I went Canadian there. Composite artistry by being more efficient. Composite. Clinicians must stay abreast of material selection and just advances in adhesive protocols because things change all the time. Better materials, always work to adapt them in. So thank you for listening. I'm going to leave my contact information up there for a second in case you have questions I can't answer tonight, which I'll stay on for. And if you want to contact me, you're welcome to. Thank you for listening. And I think that we're going to go to a Q&A.
Perfect. Thank you, doctor. This was great.
Oh, 6:00 on the dot. We should finish a bit earlier, but
no, it was great. A lot of good content to go through. So we do have a few questions for you, so I'll read them off to you if that's okay. So the first question is from Felicia and asks, how long do you schedule a class 2 for?
Well, that's a great question, Felicia. I think everyone will be different. I try to look at the patient comes in. I try to have a look at how much decay there is and what's involved with that. If you have a great team, everything set up, it depends on whether you do the anesthetic or your hygienist does the anesthetic. That's another one. But typically for me, a single class 2 like an MO or a DO, if it's on a premolar, I could probably have that done in like 20 minutes at the most. If it's a molar like an MOD or something, you'd be closer to half an hour. If it's a quadrant, anywhere from 40 minutes to an hour. It depends on your situation and depends on the size of the restoration. Sometimes even a simple MOD with a lot of caries and it's subgingival and it's bleeding can take me up to like 45 minutes to isolate and do well. So if you have an assistant that puts a rubber dam on, that saves you time too. Okay.
All right. Okay. We did get a question asking if this will be recorded. It is recorded, and we'll be sending out the recording within the next week. So just wanted to let everybody know that. Our next question asks, do you tell your patients when you create the stains in the seizures, I think I might be mispronouncing that, to not let another dentist make the error of thinking that the tooth has the formation of caries?
I don't. I do. Patients know. I do let them know that when I show them, and especially the ones that I know I put Fish and Fisher stain. I don't think many. I do fool some dentists, but they aren't fooled by the fact that they're decay. Mainly, if they took a radiograph, they'll see it's not decay at all. So I do inform my patients. I tell them not to worry about it, but for the most part, I haven't had an incident where somebody thought it was decay.
All right. See, I think that might be all the questions. We just are getting a few coming in, I think. Let's see. All right. It was another question about the recording. Yes, we will be sending out the recording within the next week. So
okay.
You can definitely come back and watch this again and go into the different cases that were presented this evening. All right. Dr. Lowe, I think that is all for questions tonight. Thank you for the excellent information.
Thank you for having me. And thank you, everyone, for taking the time off in your evening to listen. All right.
Great. I hope everyone enjoyed tonight's webinar. I certainly did. We would appreciate your feedback via our survey that will pop up on your screen shortly. As I mentioned, we did record tonight's webinar, so we will email the recording out sometime in the next week. And lastly, if you're interested in attending future webinars, you can visit www.henryscheindental.com/webinars for our upcoming schedule. Thank you all for joining us, and we look forward to seeing you on future webinars. Thank you again, Doctor.
Okay, thank you.
Appreciate it.
Good night, everyone.
All right, good night.